Start this one. All right, YouTube. Welcome to. Nikki was in the middle of saying something. Welcome to another edition of the Leadership Blend with your host, Ricardo D. Rice. Today in the studio, I have a doctor in the studio today, Dr. Nikki Hill. Say hello to the YouTube people.
Hey, YouTube. What's going on?
It's going to be an interesting day. She's soon to be family because she's engaged to my favorite cousin over here in the back, sitting in the back. I'm sliding over there real quick. What's going on, cuz?
Good morning, good morning.
All right, so today we're going to talk about how to hang on to those edges for all my beautiful black sisters.
Nice.
How you hang on to those edges, and for my fellas, the male pattern baldness type stuff, which I'm okay with. Nikki was a little too late for me, but it's okay. We're going to help you guys. So we're going to talk about all that good stuff in a couple of minutes as we go live in about 2 minutes. So everybody just hang on. It's going to be a great show. Nikki's going to give us all the 411 on that hair stuff. Now tell everybody about yourself real quick. Like, what do you do and all that good stuff?
So I'm a dermatologist, meaning I am a doctor of hair, skin, and nails conditions. I actually have a practice called Skin and Culture and Hair Center in Atlanta, Georgia, where we do full comprehensive skin care, so pediatric, medical, surgical, cosmetic, but I really have a passion and focus on hair loss disorders and scalp conditions that can lead to hair loss. So we're going to talk about a lot of things regarding hair today, all around love.
And you see how pole she is? I thought I was like, the epitome of articulation and all that good stuff. But she come in and outshine me. She had a nice little dress. She look all put together.
I got to give it to the people today.
She didn't come to play. She came to slay today. So, it's all good. We can go live in a couple more minutes. So just hang tight. All right, can you hear everything in yours?
I can hear a little of mine, yes.
You need me to turn it up? You okay?
A little bit high. You can come down a little bit. You can go down more.
Is that working?
It's that one.
Okay.
I'm good.
All right. Put that. All right, everybody. Good afternoon, good morning, sometimes good evening. Welcome to another edition of the Leadership Blend with your host, Ricardo D. Rice. Thank you for tuning in today. Hopefully, everybody had a good weekend. I keep forgetting today's Monday. You think after almost doing this a year, I would recognize that today is Monday, but today is Monday. So it's the beginning of the week, and remember, you can set the pace of your week. It's going to be a great week. I've said it, so it's going to be a great week. And just going to have a good time. So hopefully over the weekend, everybody had conversations about leadership. It is a new year, and I cannot stress this enough. It is a new year. It is still January. It is still time to get those vision boards up. It is still time to get those thoughts down on paper. Yes, it makes a difference when you write something versus having it in your head. I learned that lesson the hard way. I don't want you to learn the hard way. So it's still early. Get those visions boards done and get those ideas down on paper. And, today's show is going to be interesting because we want to help you get that hair and stuff together as well. So today is all about hair. Today is all about preventing hair loss. Today is about what to do with hair loss, all that good stuff. Today in the studio I have with me Dr. Nikki Hill. She's going to be talking about all that good stuff.
Yes.
Say hello to the people.
Hello, everybody.
So she's going to be talking about all that good stuff. But out the gate, I want to say congratulations. Dr. Hill is going to be my cousin really soon. So we want to say congratulations. She's engaged to my cousin. So I'm excited about that. And we're excited to have her on today. So we're going to talk about how you keep those edges for all my beautiful sisters out there, how you keep those edges in check. And yes, for those of you that cannot see, if you go to my YouTube page, The Leadership Blend, you actually be able to see it later on. But Dr. Hill looks amazing today. I mean, her edges are laid to the gods. You know, she looks amazing. She came in looking like she ready to slay the day. So she's going to get this stuff going today. We're going to talk about all this great stuff because hair loss is something. It's really something. And I thought it would be a show that would be very interesting. And we might be able to get her to slide some other ways too. She is a dermatologist. We might be able to slide about how to get beautiful skin and all that good stuff. So we're going to cover a number of different topics. So Dr. Hill, introduce yourself to the people. Tell us about your background, education, all that good stuff.
Okay, well, first, thank you for having me.
Of course.
So excited to be here today, especially talking about Save the Edges. You know, it's a campaign that's serious and dear to many.
It's a hashtag. We're going to save the edges. It's a hashtag.
Indeed. So just a little bit about me. I'm a dermatologist, which is a doctor of hair, nails, and skin. And I specialize in scalp disorders that can lead to hair loss. So a little bit about me. I was born to a military family, so we moved every 2-3 years. However, Atlanta's home is where I went to high school. I went to Clark Lane University, so alumni.
Oh, really?
Campus, yes.
Okay.
And then in regards to my medical studies, I went to Boston University School of Medicine. After that, I went to University of Texas, MD Anderson, which is where I studied dermatology. Now, during this passage is when I actually experienced a serious stress shed. So I lost about 50% of my hair. And if you can imagine, you know, your hair is how you present yourself. So I was losing it rapidly and without answers. So I'm looking to my groups, you know. Well, I'm studying dermatology. We're supposed to be doctors of hair. Well, I quickly learned a lot of dermatologists do not like hair.
Really?
You know, it's a time-consuming, it's a stressful condition. It's emotional on the patient. It takes a lot of time and care. And there's just not a lot of research out there about why a lot of hair loss conditions occur. And so I was kind of finding myself in an emotional roller coaster, very upset, you know, kind of just feeling a lot of despair. And then thankfully I was able to find a dermatologist, a rare one, that actually did study and focus on hair loss disorders. So I was able to get answers, which is the biggest issue. I was able to find out what was going on, why it was happening, and what could be done to get on a treatment plan. And so just having those answers and having someone kind of rallying behind me and saying, okay, this is okay, and even the biggest answer of all, yes, your hair's going to grow back from this particular type of hair loss condition, that really kind of helped because, yes, I knew I was under a lot of stress and I knew that was part of it, but then just, you know, every time you wash your hair or comb your hair, you're having just handfuls of hair coming out. Of course, that makes you more stressful. So it spirals and spirals. Stop stressing because that makes it worse. Well, I can't because my hair's falling out.
Yes.
So after that, and I was able to recover, thankfully, I realized, okay, there's not a lot of dermatologists that focus on this. And this hair loss affects so many individuals. If not that person individually, you know someone that's suffering from hair loss. And there's a lot of different types of hair loss conditions, which people don't know. It's not just male pattern, female pattern. There's over 17 different types. So I focus my career on just really completing fellowships so I could really understand hair loss conditions and how to treat them, how to diagnose them, and really help prevent other individuals from suffering from this and going through the process.
Okay, that's I didn't know. Again, you have to see her. Like her hair is just it's beautiful. I would have never guessed that you had gone through that kind of stuff. All right, so how serious is this problem? Like how serious is hair loss? A lot of times we do accredit it to stress, and people say, oh, or things like cancer or things of that magnitude. So you're telling me there's an in between ground where it's not stress and it's not some type of cancer. It just could be some other condition.
Absolutely. So I always explain alopecia, which is the medical term for hair loss. It's just an umbrella term. It's like saying a beverage. It doesn't say what kind. Is it hot, cold, chocolate, Coca-Cola? It doesn't say any of that. It's just literally an umbrella term saying hair loss, hair changes, hair not doing what it's supposed to do, like end of story. But underneath alopecia, there's two branches. So you have the potentially reversible side and potentially irreversible. Now, the reversible side is usually going to be something that's kind of a shift in the body or externally. So it can be stress, it can be surgeries, starting, stopping medications, nutrition status, supplements, starting or stopping them. It can be a lot of different type of things. But what the end or takeaway story is, the follicle in the scalp is fine. It's just a shift in the chemicals and the hormones around that follicle. Scalp is simple. It grows hair, or it fights inflammation, or distractors. It doesn't do both at the same time very well. So if there's something distracting, even if you're like, well, I moved and this happened and that happened, I'm okay. Well, scalp's like, it's not right. There's some shifts and changes, and we're gonna let all those little hairs just start to shed out. But once whatever that event was, once it kind of resolves, the follicles are healthy enough to regrow the hair. So that's reversible. The potentially irreversible is when individuals have inflammation of the scalp. And that's what we need to, we can talk a little bit about that today too, because that's the side where people, they want to have a dermatologist assess their scalp early on, because that can be the difference between potentially saving and salvaging those follicles from inflammation to now having permanent hair loss. When someone says, what is inflammation, I always explain it kind of like arthritis in the knee. So if someone has arthritis in the knee, it's inflammation. So in the beginning, that inflammation starts to change the anatomy of the knee. It starts to have some swelling. It starts to have change the symptoms. And then after a while, that individual may notice the function of that knee starts to change. It doesn't walk the same. It doesn't hold the balance the same. The same thing happens in the scalp. So now we're having all that inflammation, the swelling. After a while, we start to change the anatomy. Now, instead of having those nice follicles, they start to get replaced by scar tissue. And so instead of growing hairs from healthy follicles, we now have scar tissue, which doesn't support follicles. So that we want to catch early. And I tell people, because your scalp is still skin. So, if you have a rash or all of a sudden you always have a bruise feeling in an area, you after a while, you're like, okay, what's going on? It's time to quit. Let's go to the doctor and find out what's going on. Give me a salve, give me a cream, give me something so we can figure it out and treat it, right?
It's true.
But I talked to a lot of my ladies and gentlemen that come in, they had itching, they had really bad flaking or dandruff, they had tenderness, acne-like bumps on the scalp for years. And they didn't know what was going on. And then they start seeing patches of hair loss. So then they jump to, unfortunately, they don't know, and their stylist or barber may not know. So they go to camouflaging techniques like the sew-ins or the Beijings or the scalp micropigmentation.
I just want to say the Beijing is the devil. I got that.
I want to get you.
It's the devil. I got that one time, and all my pillowcases, I had to throw all my pillowcases out. All that dye started coming out, and it was terrible. I do not advise that Beijing. It's too much dye. And like I said, I lost all my pillowcases that weekend. But I'm sorry, it just made me angry because I remember I got that when I first moved to Atlanta. I had a barber, and my hair was thin, and male pattern baldness runs in my family.
Mm-hmm.
And I was thinning, and I got here to Atlanta, 'cause I'm from South Carolina, and I went to the barber, and the barber was like, well, yeah, it's kind of a little thin up there, so we can fix that. Oh, really? You got some magic hair? He was like, well, no, we can give you a Beijing. I was like, okay. And he finished, and it looked nice, and then when I got home, and water hit it, oh my God, my pillowcases, I'm telling you, it was terrible.
Don't do it in summertime.
You'd have thought I had on mascara. It was coming all down. It was terrible. It was a hot mess. It's a memory I want to get rid of, but I digress. You just carry on. It made me mad, just that quick. But carry on.
No, but that's the thing, instead of going to camouflaging methods where you may become dependent on them, I always tell, try to find out what's going on. Let's get to the root of it all. Let's try to understand what the issue is. If it's something we can reverse, let's reverse it. If it's something we can prevent from getting worse, let's do that too. So there's always answers, and you should look for those answers and demand them.
Okay, so it's like, all right, when they tell women for breast cancer and things like that, to check their breast. Mm-hmm. Should you check your hair scalp? Your scalp and stuff, and rub it? For ladies who have long hair and, you're rubbing it and you feel some inflammation and stuff, is that the kind of checks you would do to see if that kind of stuff is happening?
So you are the best person to know what's going on with your scalp. You have it every day of your life. So you know what's normal, you know what's not normal. You also have your skin to check behind. So if you typically are very itchy and have dry skin on the rest of your body, you may have some issues going on with the scalp too. But I always say it's a healthy scalp check. It's something that I have in my online course for stylists and barbers and trichologists who want to actually learn more about how to treat hair loss conditions. Not really treat, but really kind of identify early signs of hair loss conditions and when to refer out. I advocate the healthy scalp check is where they assess the scalp, they look at the scalp, and even the person themselves, they can feel their scalp. They can know if there's some tenderness. It's not okay to have a tender spot. You're grown. You shouldn't have a soft spot or a tender spot. That's not okay.
Even for baby hair? Even for trying to have baby hair.
We're going to talk about baby hair, too. We're going to talk about baby hair. Yes, a lot of people still calling it baby hairs. I'm like, look.
I don't even understand the term. It's cute when you got a lace front and you got little baby hairs around the edges. I don't understand it, but I thought it was a thing. So
it's cute, but if that's all the little strands you have there, then we have to talk, and that's what we want to prevent, right? We want you to have like a nice laid edge, and not just little pieces that kind of just kind of
straggle around the edges.
Yes.
I thought that was all the rage. All right, so we have to go to a break shortly, but before we do, all right, really quickly, because we can go into it in more detail, but I just want to throw it out there. Weaves in black women. Is it healthy or is it unhealthy? What do you think? What's your thoughts?
It can be healthy if the sew-in or whatever, however the attachment is not tight. Number one, that your frontal edges, those hairs are fine and thin, so you don't want to put a lot of weight and a lot of tension on them. If it's too much and they're weak, they're gonna break. If they're strong, then they're gonna rip out by the root, and they're gonna leave behind scar tissue. And that's when you have them few little strands just hanging behind. And the other thing is when someone has a sew-in, you still have to wash that hair at the longest 2 weeks. I hear ladies, oh, I didn't wash my hair, I had my sew-in for 3 months. No, wrong answer. Mm-hmm.
So would you advise it or not advise a sewing?
You can, if done appropriately and taken out within a month, it's fine. I know ladies like, a month, I pay a good month for this. But you still have to take care of that hair. So just have a stylist who knows how to take care of that hair underneath the sewing. I have nothing against them. I like them. They're beautiful. Clip-ins, sew-ins, extensions, all the above. You just have to make sure that hair is healthy and nothing's too tight on the hair.
All right, so on that note, we can go ahead and take our first break. Everybody stick around. We're going to talk more with Dr. Nikki Hill when we come back on the Leadership Blend with your host, Ricardo D. Rice. All right, Dr. Hill, you got your first segment. So All right, so what do you want to discuss going into the second segment? Because this is one of the few areas I don't know much about. So this is your lane today. So what do you want to talk about in the next segment?
That's fine. We can talk about, so we touched a little bit on weaves and sew-ins. We can talk about.
So we can build. So yeah, I'm about to say we can build. So we can start from the beginning. How stuff like that, and then kind of gradually move till we get to that. Cause I'm telling you, these next three they're gonna fly by.
Okay, so we do early signs of hair loss. Then we can go to who can help you with your hair loss, because they go through all avenues. And then last one is treatment options for hair loss.
Okay, well, we still got 3 more segments. So everybody, we just got through the first segment, and I feel like I should go get a lace front now. That's what I feel like. I feel like I can go get a lace front now. I feel like I've been approved by Dr. Hill to go get a lace front. So next thing y'all see, I'm gonna have long locks down to my back. That's what we decided today. That it's okay to do that. It's okay. So when we come back from break, we're going to go into early signs of detection, all that good stuff, how you spot this stuff early on, and the steps you should take to prevent all that, this stuff that you don't want to have to deal with in your old age, and all that good stuff. So, all right, so we're on a break, so you can tell the YouTube people something that we wouldn't guess. Tell us something we wouldn't guess about you.
Oh.
And if you don't tell me, I'm going to ask him. So
okay, so I actually was I went to Olympic trials for high jump, and I'm only 5'5".
What?
Yeah. So that lineup was like 6'7", 5'5", and jump back up. Yes. That's when I realized, okay, it's bigger than me. It's bigger than me. Yeah. So that's something.
You know, you lucky. You missed last week because I have a thing with HBCUs. So the fact you with the Clark, I was like, okay, so I'm going to refrain from my thoughts. Oh, okay. All right. Good. Go back. All right, everybody. Welcome back to this week's edition of the Leadership Blend with your host, Ricardo D. Rice, and my very special guest, Dr. Nikki Hill. Say hello to the people again.
Hello.
Oh my gosh, she makes me so sick. She has pretty hair. She's back here stroking it and playing with it. You guys have to go to the YouTube channel and see it. Like she's pretty and she knows it, so she'll fit right in with my family because most of us are too. But it's all good. All right, so when we left, we were talking about lace fronts and wigs and whether you should or shouldn't. So we're going to start from the beginning. So we're going to go into how you early detection. What are you looking for? Things of that magnitude. Because today, this is all Dr. Hill. Like I'm not. This is not my lane. I'm bald. For those that don't know, I've had curls and texturizers. And I think they burned my hair out, so now I'm bald. But it's okay because it's easy to maintain because I don't have any hair, so it's all good. I'm fine. It's all right. Dr. Hill was a little too late to save me, but she can save you. So we're gonna start from the beginning. So Dr. Hill, tell us about early detection, things of that magnitude.
So early detection, I always say early detection is key.
Oh, hold on for a second. All right, for those of you that want to call in, the number is 404-355-8699. Because I know people have questions. Feel free to call in. Dr. Hill's a lovely person. I know she can answer your questions because I'm looking at her. She's just full of knowledge today. So again, 404-355-8699 to call in with any questions. All right, carry on.
So early detection. So this whole segment we'll talk about early detection and why it's so important. In regards to the individual who is experiencing hair loss, By the time they get to me, as a dermatologist that specializes in hair loss disorders, it's 5, 10, 15 years down the road from when they potentially remember the first symptoms. So it's really important to identify and understand what those initial symptoms are. Like we kind of touched on earlier, your scalp is still skin, so it shouldn't have any symptoms. You know, the occasional itch and scratch here and there, but you shouldn't be digging into your scalp with the end of a rat tail comb or, you know, going to town patting like all day long.
Just gonna throw that out there, huh?
I'm just gonna throw it out
You just
there,
gonna throw
because
that
I
out
see
there.
it.
What about patting your weave? Is that now? If you pat your weave, is that a?
If you're patting your
If
weave,
you pat your weave,
there's probably something going on that we need to either take the weave out or we need to wash that scalp. So, or it's so tight that it's pulling the hair out of the scalp, and that can cause a little bit of itching or sensitivity. So I have my ladies that come back and they're like, yeah, this is a new sew-in. I'm like, did you take an Advil when you went home? They're like, yeah, I have to. That shouldn't be a prerequisite. You shouldn't have to take an Advil or Tylenol when you get your hair done. That's not okay. Because now that means you're pulling on those pain receptors. And those pain receptors are telling you, back up, because this hurts. You pulling the hair out to the point that these pain receptors are getting activated. So when you feel that, or you feel the need to have to go take a pain reliever, that's something not right. Tell the person that's styling your hair, hey, take it down, redo it, you know, lessen the tension, braid it less tight. You know, I understand the concept, I want to braid it tight so it lasts longer. It'll last longer, but you won't have no edges. Or you won't have any rest, you know.
all right. Well, let's dispel rumors then, because
Okay.
let's dispel. Cause we're segueing into rumors, so let's dispel some urban myths about black hair. All right. So the patting of the weave tells us there's probably a problem.
Yes, that's not okay. Either the scalp needs to be washed, or there's a lot of tension on the scalp, or you could be having an allergic reaction to either the if they did any kind of adhesive, or whether the type of the weave that's used. I mean, weave is coming out left and right. I'm like, where are they manufacturing all this weave from?
That's a lot of dead horses, a lot of bald horses running around here. I'm
and
telling
women
you.
too. But I mean, weave is just like coming. Everybody's selling weave, right?
I'm
Everybody got a
telling
side
you.
hustle. Like, I need to sell some weave. But like, everyone got a side
They
hustle.
gonna want your hair. I'm telling you now. If you go out there, they gonna want your hair. They gonna want you to cut it. I'm telling you.
But the thing is, like, the supply and demand. So what's happening? Because I have patients that come in and say, I always use this particular type of brand of weave. I switched over because this is all they had. And I had intense burning, itching, and irritation on my scalp. So the question is, what's going on with the weave? Are they treating them with chemicals? Is something happening in the packaging? You know, are they being cleaned appropriately before they're being placed on your scalp? Because outside of anything else, it's an isolated event of, I had all these issues when I used this particular brand. I keep hearing it more and more and more. So I'm kind of like, you know, try not to switch away from what you typically use and you've never had problems with that particular brand. The black latex glue, just bypass that. Like, that has black pigment and it has latex in it. It's like the top two things that people are allergic to. So just don't do it. You know, just say no. And then when it comes to, I guess in regards to the myth of that, so you got to make sure that you're monitoring how the scalp feels when you have the weave in. Patting, not good. If you got to pat too much, then you probably need to take it out, wash the scalp and wash the hair. And make sure everything's okay.
All right, how versed are you in the types of hair?
Not that versed.
Nikki, Dr. Hill, you have failed me today.
Oh no!
You
mean all the colors and the numbers? They're like, this is a number. I don't know.
I'm familiar with Wet and Wavy 66. I'm familiar with Wet and Wavy 66. My friends wear it, so I'm shouts out to Wet and Wavy 66. All right, so apparently there's like virgin hair and there's stuff like that. Like, do you know what that stuff means? And I'm just tossing it out there because we segue that way.
The gist of it is that it's human hair that hasn't had any chemicals in there. It hasn't had a relaxer, any color. It's virgin hair. It's grown straight out the scalp, and it, you know, aside from, you know, shampoo and conditioning, not much else has been done to it chemically.
So that's a good thing.
That's a good thing. Everyone's on that relax now, but you know, it just depends on what the ethnicity of the person or the hair curl pattern of the individual that had the virgin hair. You know, virgin hair on me is going to be curly. Virgin hair on an individual who is a Caucasian background may be wavy or tightly curled or straight. So it also depends on just the ethnicity of the individual and their curl pattern. All
right, let's go to another minute. I know I didn't prepare you for this, but since we segued over there, you know, we're going to say kids and relaxers.
If you can hold off, do hold off. I just recall and going back to when and bless my mama's heart.
All right, well, hold on. We actually have a caller.
Okay.
All right, so caller, you're on the air with Ricardo D. Rice and Dr. Nikki Hill. What is your question or comment?
So the question was, if there's a rash on the skin, is the biopsy the only way to really determine what the diagnosis is? And that actually applies to the scalp as well. So when there's a rash, you go to your dermatologist who studies skin conditions. However, there are over 300 different types of rashes, and depending on what it looks like, where it's located in the pattern, you try to lump it into a particular diagnosis. And there are certain patterns and rashes that look very typical for certain conditions. But sometimes if it's something that they really need to rule out, like say for instance, it's a type of skin cancer, and yes, African Americans and other minorities can develop skin cancer, myth. So that's real, okay? But people are not spared from skin cancer. So sometimes they do biopsies to rule out, sometimes they do biopsies to really make sure they have the accurate diagnosis, because especially if it changes their treatment, then you really want to make sure that you're on the right path. So say if they're kind of saying it's maybe rash, diagnosis A or diagnosis B. Diagnosis A, we can get away with creams, but diagnosis B, we are going to have to put you on by mouth treatment, and we're going to have to monitor blood work and blood pressure. Well, that's a big deal. So instead of really having to make sure, that you're on the appropriate treatment and we're not putting you at risk for other side effects of being on medicine, sometimes the best route is to do a biopsy. And the same, sorry, go ahead. And the one thing that I guess the caveat about dermatology is I hear right now you're kind of explaining what the rash looks like and the pattern that it moves around in. The one thing about dermatology is we actually have to see and touch the rash. Unfortunately, hearing about the rash is not the best way to really understand what's going on. We need to hear the story. We need to understand the background. So without actually seeing it and being able to touch anything, my best advice is to really kind of find a dermatologist that's in your area for them to look at the rash and be able to best give you medical advice once they've assessed everything, including your medical background. Yes, ma'am. Yes, ma'am. So it would be, I agree with you. You should definitely get a second opinion, and just so you can find a dermatologist that can really assess and get the accurate diagnosis for you. So fantastic. So the concept of dry shampoos. So dry shampoos are kind of like talcum powders or other type of powders that can really absorb oil and moisture out the hair. It's a go-to, like, okay, I'm not going to be able to get to my hair today, but I need to prolong the process and dry up the oils on my scalp and on my hair for maybe another day or two. It's not an alternative to shampoo and conditioning. So it's okay to use at a one-time in-between wash cycles if you're delayed a day or two, but you don't want to rely on that because you do need to remove the oils in its entirety and the debris and dust and just overgrowth of natural yeast from the scalp using shampoo and conditioner.
All right, caller, thank you. You have a good day.
Now I got another room for you.
All right.
That goes back from way back. Greasing that scalp. Hey. All right, greasing that scalp.
So no Crisco. Are you about to tell me I can't use Crisco?
But they don't. Everyone's advanced now. They do the coconut oils. They do the olive oils.
Is that stuff good?
I mean, in moderation on the skin is fine. But the concept of oil on the scalp, So first, all your oil glands are associated with hair follicles. The larger the hair follicle, the larger the oil gland. So in general, oil glands around the hairs are nice, and you have a lot of oil glands up there. A lot. Way more than skin on the face. So oil in the scalp is basically like not washing your face for a week or two, and then slathering Crisco or whatever your oil of choice is on your face. In the meantime, if you can imagine how many pores have you clogged up, the acne, the rashes that you're probably going to get from that, the overgrowth of yeast. So I tell everyone, you don't need to oil the scalp. You can moisturize the hair, but the scalp doesn't need to be oiled. If you're having dry scalp or flaky scalp, then there's something else going on that we need to address. But you make enough oil to cover that scalp and cover that hair on a regular basis.
So you need to put like, okay, I'm bald.
Mm-hmm.
So should I put something on my bald head?
Well, you treat your scalp like regular skin now.
So I can put lotion on
You
it?
can put lotion on there. You can
Oh,
moisturize it.
Okay, I tried that this morning. So, I'm not putting this, because I sometimes put Vaseline on. I say, I'm not going to put Vaseline on today. I'm going to put lotion on today. And I did the right thing today. I feel good. So on that note, we're going to take our second break. And when we come back, we're going to dispel some more myths. And we're going to talk about how to find early detection. So y'all stick around on Leadership Blend with your host, Ricardo D. Rice.
All right.
See, I told you we can have a good time. We can have a good time. All right, buddy. So we was just dispelling rumors, which Dr. Hill didn't know we were going to do today, but we kind of segued there. So I told people you have to be ready for anything on the Leadership Blend, because that's leadership. And with leadership, you might encounter all kinds of things. But she handled it with such grace. I apologize for that, caller. That's what I was telling you about. Right?
No worries.
You never know where people are going to be calling from. And yeah, okay, so you guys couldn't hear it. We just had a caller that was describing her rash to Dr. Hill, and yeah, she handled that with such grace, because I was getting ready to cut the call. But yeah, she answered that. And she was talking about dry shampoos, so hopefully y'all caught that about the dry shampoos. I didn't know anything about that. They said, does it come in a bottle or a box?
Which one?
Dry shampoo. What is that?
It comes in a bottle. It's like a little powder. You just kind of, but it's a white powder. So it's, if you can imagine, on darker hair, it's a little messy. Now they have some that have a little bit of pigment in them, but usually they're white, and it's a fine particle. You can just kind of brush it out, but it's kind of like Gold Bond powder, basically. A lot of people put that on.
So it's not like shaving powder. The one I started using, that you mix
Yeah.
it with, or mind you mix with water, but it looks like
Yeah, you just put
powder.
it on. It absorbs the oil, and you try to brush it out or pat it out as much as possible.
they make shampoo each other pat out now.
You know.
So wow, okay. I didn't know they did that. That's new. I did not know that they made waterless shampoo. That's new. Is that new? How long has that been out?
Oh no, it's been out for the ages. Yeah. It's like how people used to wash their hair back in the day.
Oh. All right, so I got a question about my head.
Uh-huh.
All right, so when my hair grows back, should I continue to put lotion on, or should I change it when it starts growing back?
So the difference is going to be if there's more increased oil secretion, then you're going to not want to put thick things on the scalp. It goes on the hair. So right now, this scalp is similar to the skin.
Oh, okay.
So you treat it like that. They can't hear me on the Instagram Live. I don't know why.
All right, everybody. Welcome back to this week's edition of the Leadership Blend with your host Ricardo D. Rice and my very special guest, Dr. Nikki Hill. And we were just dispelling myths. And we did have a caller who was asking about. Look, that call was new for me because I didn't know they made waterless shampoo. That was new for me. So thank you, callers. I got schooled today because I didn't know they did that. But apparently it's a thing. So we continue on with things. When we left, we were talking about kids and doing relaxers and perms and all that stuff. So Dr. Hill was saying that if you can wait for whatever reason. Was there a particular reason for that?
The question's in regards to what's really happening with these inflammatory scalp conditions. The question is if it's how long duration trauma has been really exposed to the scalp. So in trauma, that I always say there's no such thing as that good burn. A lot of ladies think, okay, let me put that relaxer on and let it burn so I know my edges and my hair is good and straight. No, that's another myth. Relaxers are actually timed systems, and you shouldn't be telling your stylist when you're ready to go get it rinsed out. Like, it should be timed and removed. But the longer that process, unfortunately, you can't prevent relaxer from getting on the scalp. So the longer that process keeps happening, there may be a trigger from that trauma that starts that inflammation. So not that relaxers cause inflammation, because that's we don't have that direct correlation, but just really more potentially trauma and burns from chemicals. If you can prolong that as much as possible and shorten that type of reaction as much as possible, then that would be the best. So I say if you don't have, and natural's cute. Like, they got all kinds of styles for natural, especially in little girls. I love it.
Oh, I was talking about little girls. I'm about to say, because all natural
Oh, yeah.
ain't beautiful.
You gotta work with naturals.
All natural's not beautiful.
Aw.
I'm with it, but sometimes I think it's an excuse to be nappy sometimes, and that's not always a good thing. But, I'm with it. I'm with it. For my sisters that rock natural, I'm definitely with it. But, my real homegirls, they keep it cute. As long as you're keeping it cute, we good. But it's some other time. All right, so let's go back to earlier, because we got sidetracked with dispelling myths, which is a very good thing. I'm trying to make sure we get all of them, because today's show is quite important, because, after hearing all these things, now I realize, I don't have any hair, but I did have hair, and that tingling thing, I thought that was a thing, so I might need to stop doing that with my shaving cream, because I started shaving my head with shaving cream, and I was like, well, until it tingles, it's not coming off, but since you said that's not good, I better stop doing that.
You just want to make sure that, I always say there's no such thing as a good burn, no such thing as, letting the irritation of that scalp, because chemicals are chemicals, especially like the depilatories and all that type of stuff. You can't prevent it from getting on the skin, but if you ever use like a nair or something like that, your skin feels real weird afterwards. Like everything just kind of looks and feels and smells kind of odd. So you just want to make sure that there's not a lot of irritation or sensitivity, and especially if there's itching, then you can be allergic to stuff too. So always say, if like even with shampoos, I have a lot of patients who will like wash their hair or use a conditioner and is itchy or red, like not even just the scalp, but also down the back of the neck where the shampoo drained. So I always say, you can be allergic to things and natural stuff. Just because it's natural doesn't mean it's amazing for you, okay? Sometimes it clogs the pores. Sometimes it can lead to allergies. So I always say you just need everything in a little moderation. But if you have symptoms and stuff, you need to pull back.
Okay, so can you go, because I realized because I just started using shaving powder to shave my head, and I was like, okay, well, this might be a little strong. So then I went back and tried to find because most of the containers will tell you heavy duty, light. So should they keep that in mind as well? Like if you're using a type of relaxer and it's really strong and it burns and all that good stuff, taking it down a notch?
Yeah, so in reality, relaxers are supposed to just go in that little bend of new growth. It's not supposed to go on the scalp. So that's why you have to base the scalp, because in reality it's going to get on the skin. So you have to make sure the scalp is based. And even when you have that relaxer applied to the scalp, it's time. So it shouldn't really be getting to the point where it's itchy and irritating. But if you have burning, then you may actually have some allergies, or you may not be able to tolerate that. Now they have like the kitty relaxers, the calcium hydroxide relaxers in different types, but they all the gist of them is to basically break the bonds and break the hair down. So if you can imagine, it's all keratin in your hair, but you also have keratins in your skin and your scalp. So after a while, you leave it on too much, it's going to start breaking down the skin. So that's when you start getting the itching and the burning, because now it's affecting those pain receptors, because it's gotten down in the skin and affected those pain receptors. So that's why I always kind of break it back down. Like they have mild, they have children's form. They're very similar. It's really just making sure the scalp is prepared appropriately and nothing's left on too long, and it's actually applied the way it's supposed to be applied. So that's why I tell everybody, if you're going to get a relaxer, don't go buy that box brand from the store. Let your professional stylist do what they gotta do.
You will stop stepping on my toes. 'Cause that's what you will stop taking. When I had a texturizer, I used to do it myself, and my curls were popping, but my scalp wasn't. So and here we are today. So I'm a lesson learned that you might want to follow the box, which I guess I should start doing that with my shaving powder too, because it says 4 minutes, and I used to go for 6. Okay, so okay, so I learned something new today. I'm tired of my guests coming here stepping on my toes.
Oh.
That's not why I brought you here, but it's
for
fine.
good reasons.
Yeah, fine, whatever. We'll go with that. All right, so let's go back to early detection. So, is there things they should look for? Because I guess the thing is, that skin, the hair stuff is like skin. For us, everyday folk, it's just kind of like, well, it's a scalp. So it's probably anything I really do to it is probably going to do little things. Are there certain little things that can lead to big things that we should definitely be on the lookout for?
So we talked a little bit about the allergies. If something makes your scalp itch and you keep using it, you want to stop it. basing that scalp and making sure you're getting your professionals to apply those chemicals to the scalp. If you're having really bad dandruff and flaking and itching of the scalp, that's not going away with just regular Head and Shoulders and over-the-counter anti-dandruff shampoos, then you may have a medical condition that's causing that, and could potentially actually be a hair loss condition that's giving you those symptoms. And then we talked a little bit about, making sure if you do any sew-ins, even bunning styles, my man buns, my locksters out there that are locking their hairs, even the sister locks. You just want to make sure they're not too tight, because all that is tension. And if that hair is weak, it breaks. If it's strong, it's going to pull it out by the root and it's going to leave behind scar tissue. So those are kind of preventable things that you can do on a day-to-day basis just from styling and hygiene for the scalp that can help prevent hair loss. Other things, everyone wants to experiment, so it's okay to do colors and things like that. But again, hair breakage is something different. That's just maintenance of hair. But when it's like now, okay, there's a smooth spot or there's like a focal area of hair that's just continuously broken and won't grow, then there's something going on deeper, and that's when you need to see a dermatologist that specializes in hair loss disorders. The reason being, I can look at the scalp with certain tools called dermatoscopes, but then sometimes I actually have to do a little biopsy of the scalp. The reason being, the biopsy can actually give me a picture of what's going on deeper in that skin, which is scalp, and tell me if there's inflammation there, if there's scar tissue there, if it's something we can reverse, if it's something we need to stop from progressing, or if it's even like burnt out or active. So it gives me a lot of information, and that's kind of where I always, and we can kind of, you let me know if you want to segue into it, but in regards to who really helps kind of identify these, like when you're experiencing those symptoms, who do you go to? Because, I always tell everyone, by the time they come to me, it's 5, 10, 15 years. So who are they seeing in between? The person and the individuals they see most frequently is going to be their barbers and their stylists. I always say that's who the frontline defense is when it comes to hair loss and kind of detecting these early. And that's what my whole course is about, is kind of identifying what these red flags are, having the dialogue and having surveys that your clientele can actually fill out while they're waiting for you. So you can say, okay, this is going on, because they trust you. They see you every single, either week, 2 weeks, 3 weeks, once a month, however often they get their hair done. So it's just important that they're able to identify and see what's going on in the scalp, because how often are you able to see your scalp yourself? You can have 2 mirrors and trying to figure it out, but if you can't see it up close, it's hard and difficult. So I always say, rely on your stylist and your barber. You trust them to do your hair, so trust them to also kind of make sure your scalp looks good. Let them know if you have any symptoms. The trichologists, those are individuals, as cosmetologists or barbers that have done additional training, and they can help with maintenance of healthy hair. So they can help make sure that you have the appropriate products. They can make sure, if they need to style the hair appropriately while they're helping you to grow the hair out, then that's their areas. When there's areas that you can see on the scalp that have lost density, when there are short hairs that are really low and close to the scalp, and also when there's redness, acne-like bumps on the scalp, bruising, tenderness of the scalp, that's when you need to have a dermatologist that specializes in hair loss disorders assess the scalp, because that is when it's a obvious pivot, like across in a row. We are either going to be treating reversible hair loss or irreversible hair loss. And I always tell my stylists and barbers and trichologists, you don't want to be the individual that could have held back that patient from potentially having reversible or preventable hair loss. So it's very important to just make sure that you kind of go through those parameters, but if you have those symptoms that you're feeling, then you really should kind of just meet with the dermatologist at that point.
All right, so in lines of defense, you have the barber or the hairstylist, and then what's that next thing you say, try something?
A trichologist, yes.
I should make you spell that, but I'm not going to make you spell it, because I'm interested.
I
know you can, because I know you're educated, and I know you're the bomb.com, but I know you're the bomb.com, but I digress, because I can't spell it, so I can't even check if it wasn't. All right, so that's the next. Is that like a barber or a hairstylist? Or?
So they're barbers and hairstylists and cosmetologists. They have typically done, they've either worked with an individual or taken some courses where they can learn a little bit more about healthy hair. So it's the hair shaft, the hair fibers itself. But when it comes to the scalp, then that's dermatology kind of territory, because that's when, there's medical reasons why the scalp is acting the way it's acting. And as much as I love natural treatments, there's a time and place for them. And I talk to my patients when they come in. We spend about 45 minutes going through their hair journey, their symptoms, what's going on, doing examination. And I give them this straightforward, like, there are certain conditions we can try natural treatments, and there are certain conditions we have to stop this inflammation because we have to be aggressive. So I always tell any trichologist or anyone that wants to be a hair loss expert, you have to know when to hold that person, and you have to know when to refer them out, and that's the biggest distinction of who is really stepping out on the platforms and being ahead of the game and being a hair loss expert. Because unfortunately, sometimes if you hold that client and try different type of products, but they really need medication to shut that down, you may miss the opportunity to stop that inflammation early and potentially regrow some hair.
All right, so with that, I'm terrible with words sometimes. That try person, is there some lettering that goes behind their name so that you would know that they've done that, or it's just a matter of it's luck of the draw?
Well, they do refer to themselves as trichologists. It's not a board. It's not a state license.
Okay.
So it's usually there's either courses or classes or schools, but it's not recognized by the Board of Cosmetology yet as trichology being a licensed provider.
Is this something new?
It's not new, but I think it's getting a lot of, well, I can't say it because I'm new in the hair game, but I did not hear about trichologists before, but they've been around forever. Like trichology schools have been around for a while. I think now it's just more because of social media and everyone's kind of being more health conscious, and everyone wants to really understand and preserve and look the best on a day-to-day basis, and being proactive about things and really wanting to find answers. I think that's where trichologists and hair loss experts and hair professionals are really knowing that this is a niche. It affects a lot of people, and they're stepping forward.
All right, so when we come back from break, we're going to be in our last segment. So 404-355-8699 to get in those last-minute questions with Dr. Hill. And we're going to talk more with her when we come back on the Leadership Blend with your host, Ricardo D. Rice.
All right.
She's doing good, cuz. She's holding her weight. She's holding her weight.
All right.
I knew she would, but she's holding her weight. All right, so last segment, I typically do a wrap-up. So any final thoughts you want to leave? Tell them about where you are, your information, and some of that magnitude.
Okay. Can we talk a little about treatment?
Yeah, we can do that.
Probably 2-3 liner of it.
Yeah, we can do that. This is the last segment. So whatever you want to throw in.
Okay.
Because I said this is where I do my plugs. So we start talking about my book and my website and all that stuff. So you can do the same thing.
You just give me a little cue when you like, like.
Look, you family, so I give you a little extra. You get a little extra time to promote your stuff because you family. So we can give you some extra time to promote your stuff. But yeah, we talk about treatments. And I said whatever you want to do in the wrap up. Because I said this is your area. And clearly you're very passionate about it, which I knew you would be. So that's why I was like, let me reach out to my cousin.
You said what?
You did good, cousin. You got right back with me. I appreciate it. You got right back with me. I appreciate it. So yeah, we give you some extra time to talk about your practice and stuff.
Okay.
So where's your practice? You're in
Tucker. It's like 285. You know where Spaghetti Junction is?
Yeah.
Right below it. Right off of 285. La Vista,
God, that
North
traffic
Lake.
is terrible. Jesus.
Well, we're right below it though, so I'm not right at the 85, 75, 285.
Okay.
I'm like 1 or 2 exits below it, so it's not. It's Atlanta, but it's not as bad as it could be.
So how's business?
It's good. We're about to move so we can get some more space.
Nice. Same area?
Same area. I know I keep wanting to like move, but
You need to come on the Cobb. Come on up here.
Ooh.
Come on up here and get this good money.
I have to give me a second house if I'm up there.
Hey,
Right?
make it happen. Make it happen. Make it happen.
That's a lot of highway.
I don't know if I live in a place outside of Cobb. Maybe because I've been here since I got here. Because I started in Vinings and then I lived in Marietta and I just stayed in Marietta.
It's a
I have
good
no
place.
idea.
Don't get me wrong. It's beautiful up there, and you got you still have trees and stuff up there, right?
Yeah, but it's not like them other places. Like those country places. All right, everybody, welcome back to this week's edition of the Leadership Blend with your host, Ricardo D. Rice, and my very special guest, Dr. Nikki Hill. All right, so we're in our final segment. So she's going to give us the treatment options, all that good stuff. You're going to find out where you can get in touch with her at. Because, look, just as poised and as educated as she is sitting with me, I can promise you, and we actually have a caller. So, caller, you're on the air with Ricardo D. Rice and Dr. Nikki Hill. What is your question or comment?
So if you are having hair loss, then you definitely need to see a dermatologist to assess what's going on, because itching is one thing, but when you actually start having patchy hair loss or hair loss in general, then what you always want to make sure is you're not missing permanent hair loss and scar tissue that's developing. In regards to the biotin, that's something we can touch on. Biotin just helps strengthen hair; it doesn't grow hair, so it doesn't increase the growth rate. It just helps strengthen hair, strengthen nails. For some of my patients, when they take too much biotin, it can actually give them acne, but it can, if they take way too much biotin, then it can actually interfere with their lab work. So their lab blood work can be altered. So I always kind of say be careful and cautious if you're taking biotin by mouth. But topically, to grow hair, it's not been clinically shown to do that. The other product, and I'm blanking on the way to say it, but I know what you're referring to, the Redensil or something. It's kind of an alternative to minoxidil, which is found in over-the-counter Rogaine products, and the generic form is minoxidil. It's been shown to keep or allow those hairs to stay in a growth phase, so they don't go into a rest phase or a shed phase like they naturally would. But the biggest thing, and I always say diagnosis is key. There's over 17 different types of hair loss conditions, so you can't really, and you don't really want to assume that you have a reversible type, because unfortunately that's a downfall of a lot of patients that come into the office and they have permanent scar tissue and it's the size of a grapefruit, and when it began it was the size of a dime. And so it can happen slowly over time, or it can happen rapidly over time. So you really want to make sure you get an accurate diagnosis early in the process. With dry scalp and flaky scalp, sometimes that can be from overgrowth of natural yeast. It can be allergies to treatments. It could be eczema, psoriasis of the scalp, or it could be inflammation of the scalp that's leading to hair loss. So I kind of, and just for anyone in general, if you have symptoms, to not really discard them or discredit them, just really kind of understand why you're having them, because it's not normal to have continuously itchy or dry or flaky or tender or sensitive scalp. In regards to a lot of the products out there that claim to grow hair, there's not a lot of clinical trials in these products, so I never really advocate any of them. What I do in my practice is we really kind of find, once we get an accurate diagnosis, because not everything's going to work for a different type of hair loss conditions. So once we get an accurate diagnosis, then we have appropriate treatment options that we can talk about. Some of them can be natural treatments. If it's a reversible type of hair loss disorder and we have time and room, we can talk about natural treatments. There's one natural treatment that's really big that I'm absolutely really excited about. It's called Platelet-Rich Plasma, or PRP. It's your own natural stem cells and platelets, so essentially it's your body healing itself. So what we do is like a regular routine blood draw. We pull out your blood, we spin it down with a special machine. We pull out the platelets, the growth factors, and then we're injecting them into the scalp. The scalp is numb, but we inject them into the scalp in the areas that we want to stimulate growth, thicken hair. So it's very little downtime. It takes about 45 minutes, and it's all natural, so you can't have any allergies to it. It's all your own blood. There are other treatments that I offer in regards to by mouth treatments, topical treatments. We can do combination treatments that are natural or may have some medication in them. And then the last treatment that the last two, scalp micropigmentation. So it does two things. If you're a male, it can help kind of give the look of shaven scalp. So it can restore the hairline. Oh yeah, we'll talk about that too. It restores the hairline. It gives the illusion that you have follicles everywhere, that you're just having an optional shaven scalp. Or you can do a hair transplant, which is taking individual follicles, moving them from the back of the scalp, and then placing them to the top of the front of the scalp without scars, that long scar. So we have a lot of options. You're welcome.
All right, Carl. Thank you for your call. You have a good day. All right. You got like 4 minutes. So you're so thorough. I love you. So thorough. You know what you're talking about. All right, you got 4 minutes. So treatments, how to get in touch with you, all that good stuff.
Okay, so we talked a little bit basically about kind of the treatments that are out there, oral, topical, and when you do surgical, we could do hair transplants, we could do linear strip transplants, or we could do the individual follicle transplants, so you don't have a long scar, less downtime, no one really even knows what happened, just all of a sudden they start seeing hair growing. Or we can do scalp micropigmentation. In men, it gives the illusion of the shaven scalp look. In women, it can kind of give a little bit more density in that area. And then in regards to the hair, those are the hair transplants. And then we can actually do medical grade scalp, they call them scalp prosthesis, which are just basically wigs customized. But we can get your insurance if you have that right, or we can get the insurance to cover your wigs and weaves. So ladies, yeah. And men too, because now they have like the man weaves.
I'm about to say, I'm thinking about getting the man weave. I might have curls next week. They might have curls next week.
Yeah, so we have a lot of options. So the first thing is always to make sure we have their accurate diagnosis. So if anyone is interested in kind of really understanding what's going on with their scalp, their hair, even just doing a healthy scalp check, you can always reach out to me at the website, SOCA Center, SOCAH Center.com. You can call us at 404-474-2301, or you can always follow us on social media at Dr. Nikki Hill.
All right, do that again. You talk as fast as I do.
Oh.
So you have to do that again. You talk as fast as I do. All right, so do that again. How did he get in touch with you?
You can find us on our website at SOCA Center, SOCAH Center.com, or you can give us a call at 404-474-2301, or you can follow us on social media at Dr. Nikki Hill.
That was better.
Thank
So
you.
people can understand. I want to make sure y'all reach out to, because as y'all can see, she knows what she's talking about. After this show, I feel like I can get a lace front, or I can get me some curls and actually know what's going on. So, we want to thank Dr. Hill for coming in. Any other final thoughts?
No, just be proactive with what's going on with your scalp and your hair. Demand answers. Time is follicles.
And there's the applause. All right, for those that do not know, my book, Calculated Conflict, comes out on February the 15th, but pre-sales are already going on. And yes, you asking, can you get this book on Amazon? You sure can. You can go right to Amazon.com. And again, it's called Calculated Conflict. It's a leadership book. A lot of the stuff that I talked about when I first started the show, generational leadership, understanding Generation X, Y, Z, all that good stuff. I even go over some of the leadership theories. So transformational leadership, situational leadership. If you don't want to go to school, but you want to be a good leader and you want to be able to sit on panels with people and understand the dynamics of leadership, this is the book for you. I promise you. Y'all know how I love examples. I make it really simple, and you'll feel like a scholar when you're done. And it's only $12.99. You spend more than that at Hardee's. I promise you. I went the other day. You spend more than that at Hardee's, or 2 or 3 combo meals at McDonald's. So you can take that money and invest it in me and what I'm trying to do to help you be better leaders. Also, I have a blog now, so if you go to ricecommunity.com, Rice with a W, you can see my leadership blog, and I talk about all kinds of stuff. It's I think this week we were talking about servant leadership, and is it creating one-dimensional leaders? Because we teach them servant leadership, but are we teaching them the transactional side of it? How to get it done. What would Jesus do? And also, but he understood the dynamics of leadership. So all that great stuff is on my blog, on my website, ricecommunity.com. Go buy the book, Calculated Conflict, Amazon.com. Thanks to my very special guest, Dr. Nikki Hill, for coming in and educating us on platinum weaves and how to hold on to them baby edges that you may or may not have. And next week, we're going to have the owners of a women's basketball league are going to be here next week. The name escapes me, but go to ricecommunity.com. It's going to be really interesting. Remember, leadership is everywhere, and you might actually be a great leader or a great manager. So take the time to enjoy everything. I will see you guys next Monday, 11 a.m. on The Leadership Blend with your host, Ricardo D. Rice. Have a great week. All right.
Oh, Lord. Thank you. Thank you
Thank you for coming. I feel all educated now. Like I said, I feel like being bald might be a choice now. Can go get me a man weave or something.
Oh.
I know the dynamics of it. All right, YouTube, as you saw, Dr. Nikki Hill held it down real nice and lovely. And she's lovely, of course. You and this hair, just...
Oh, thank you. I gotta be a product of, gotta be the face of the product.
Look, I'm not mad. You can walk on them covers. They're like, well, I want a hair like you got. No, people, this is not straight 66. This is real. This is all real. This isn't wet wavy 92. All that good stuff. Thank you for coming through today. Tell the people how to get in touch with you again real quick on YouTube.
Yes, so if you're interested in kind of understanding what's going on with that scalp and even options to stimulate that growth, you can find me on the website, SOCA Center, SOCAH Center.com. Or you can call 404-474-2301. Or you can follow me on social media at Dr. Nikki Hill.
And I will leave her information on my website, ricecommunity.com, so you can look her up through that. As you can see, she knows exactly what she's talking about. I was so honored to have you in here on today. Appreciate shouts out to my cousin over there in the corner for making this connection, because this is a great connection. And we're going to have Dr. Hill back real soon so she can really get into it. That's dispelling those rumors, because that's a lot of stuff that we have going on in our community about hair and what you can and can't do. And we had 2 callers today. That's a record.
No.
A record day with like 2 or 3
No,
calls.
honey.
I'm trying to avoid them calls, But we thank you for coming in. So you guys, this video will be up probably in about an hour or 2. So you can check out my YouTube page at The Leadership Blend and see the whole show and see, well, you already seen her, but somebody walks up and you can see her in the studio, not only just hear. And also check out the transcripts because I have a SoundCloud page. So you can actually hear the calls on the SoundCloud page, which is also The Leadership Blend. So go to The Leadership Blend SoundCloud. You can hear the calls. It's the actual show transcript. So you hear everything. So check that out as well. I will see you guys next Monday when we have the owners of a women's basketball league here in Georgia, a professional basketball league. So we're going to talk about that kind of leadership next week. So I will see you guys same time, same place, 11 a.m. Love 860 a.m. iHeartRadio on The Leadership Blend with your host, Ricardo D. Rice. Say goodbye to the people, Dr. Hill.
Bye.
I will see you guys next week.